1. What is the primary purpose of the Functional Independence Measure (FIM) assessment tool? A. To measure patient satisfaction with rehabilitation services. B. To document the severity of disability and track functional outcomes in rehabilitation settings. C. To determine insurance reimbursement rates exclusively. D. To assess cognitive function only. 2. What is the relationship between FIM scores and rehabilitation outcomes research? A. FIM scores have no research value. B. FIM scores provide standardized, quantifiable data that enable comparison of outcomes across patients, facilities, and treatment approaches. C. FIM scores are only used for billing. D. Research cannot use FIM data. 3. In the FIM scoring system, what does a score of 1 indicate? A. Complete independence. B. Modified independent. C. Total assistance. Patient performs less than 25% of the task. D. Supervision or setup required. 4. Which communication skill is essential when there is disagreement among team members about a patient's FIM score? A. Avoiding the discussion to prevent conflict. B. Using objective criteria from the FIM manual, citing specific observations and seeking consensus. C. Deferring to the most senior team member without discussion. D. Each person maintaining their own score without resolution. 5. According to adult learning principles, what is the most effective method for training healthcare professionals to administer the FIM accurately? A. Providing written manuals only. B. Combining didactic instruction with hands-on practice, video examples, and competency assessment. C. One-time lecture without follow-up. D. Self-study without any formal instruction. 6. What does a FIM score of 7 represent? A. Minimal assistance required. B. Moderate assistance required. C. Complete independence. D. Supervision required. 7. How many items are included in the complete FIM assessment? A. 13 items. B. 18 items. C. 22 items. D. 30 items. 8. In the context of the FIM, what is the minimum score a patient can receive across all 18 items? A. 0. B. 18. C. 36. D. 126. 9. What is the maximum total FIM score a patient can achieve? A. 100. B. 126. C. 140. D. 180. 10. Which principle of adult learning is most relevant when teaching clinicians to use the FIM in their daily practice? A. Adults learn best through passive observation only. Adults need to see the practical relevance and immediate application of the FIM to their clinical work. C. Adults prefer theoretical knowledge without practical examples. D. Adults do not need feedback on their performance. 11. The FIM assessment divides into 2 major subscales. What are they? A. Physical and emotional. B. Motor and cognitive. C. Sensory and motor. D. Activities of daily living and social skills. 12. In FIM scoring, what distinguishes a score of 5 supervision from a score of 6 modified independence? A. Score of 5 requires hands-on assistance. Score of 6 does not require physical contact. B. Score of 5 requires cueing, setup, or standby assistance. Score of 6 requires assistive devices or extra time, but no helper. C. They are the same level of function. D. Score of 5 is complete independence. Score of 6 requires assistance. 13. When developing a curriculum for FIM training, what is the first step that should be taken? A. Design the final examination. B. Conduct a needs assessment to identify learners' baseline knowledge and training requirements. C. Purchase all training materials. D. Schedule the training dates. 14. Which communication technique is most important when discussing FIM scores with patients and families? Using highly technical medical terminology to demonstrate expertise. B. Explaining scores in clear, understandable language while relating them to functional goals and progress. C. Avoiding any discussion of scores to prevent patient anxiety. D. Only discussing scores with other healthcare professionals. 15. What does the term burden of care refer to in the context of FIM scoring? A. The emotional stress on caregivers. B. The level of assistance required from another person, measured by the amount of physical or cognitive help needed. C. The financial cost of rehabilitation. D. The patient's subjective feeling of dependency. 16. According to regulatory requirements, how often should healthcare professionals using the FIM complete reliability training? A. Never, once initially trained. B. Periodically, typically annually or biannually, to maintain scoring accuracy and inter-rater reliability. C. Every 10 years. Only when changing jobs. 17. In the FIM motor subscale, which of the following activities is assessed? Problem solving. B. C. D. Social interaction. 18. What is inter-rater reliability in the context of FIM administration? A. The ability of one rater to score consistently over time. B. The degree to which different raters assign similar FIM scores to the same patient. C. The patient's reliability in performing tasks. D. The speed at which assessments are completed. 19. Which adult learning theory emphasizes that learners need to understand why they are learning the FIM before they commit to training? Constructivism. C. Andragogy, adult learning theory. Cognitivism exclusively. In FIM assessment, what is the recommended observation period for scoring? A. Single observation at one point in time. B. Multiple observations over a 24-hour period to capture typical performance. C. Only when patient is at their best. D. During therapy sessions only. 21. What does a FIM score of 3 indicate? A. Complete independent. B. Moderate assistance. Patient performs 50 to 74% of the task. C. Minimal assistance. Patient performs 75% or more of the task. Total assistance. 22. Which of the following is part of the FIM cognitive subscale? Aiding. B. Comprehension. C. Transfer to toilet. Grooming. 23. When mentoring new staff on FIM administration, what is the most effective approach? A. Expecting perfect performance immediately without guidance. B. Providing structured observation opportunities, guided practice with feedback, and gradual independence. C. Having them read the manual without any hands-on practice. Criticizing errors publicly to motivate improvement. 24. What is the primary regulatory body that oversees the standardized use of FIM in inpatient rehabilitation facilities in the United States? A. The Joint Commission. B. Centers for Medicare and Medicaid Services, CMS. C. Food and Drug Administration, FDA. D. National Institutes of Health, NIH. 25. In curriculum development for FIM training, what type of evaluation assesses whether participants can accurately score FIM items after training? A. Formative evaluation only. B. Summative evaluation with competency testing. C. Process evaluation exclusively. D. No evaluation is necessary. 26. What does the FIM item bladder management assess? A. Medical diagnosis of incontinence. B. The level of assistance required for complete bladder control and use of equipment or agents. C. Frequency of urination only. D. Psychological adjustment to incontinence. 27. When a patient requires cueing or standby assistance but no physical contact during an activity, what FIM score should be assigned? A7, complete independence. B6, modified independence. C5, supervision. D4, minimal contact assistance. 28. Which principle of learning is applied when FIM training includes video examples of scoring scenarios? A. Abstract conceptualization only. B. Multimodal learning that combines visual demonstration with conceptual understanding. C. Elimination of hands-on practice. D. Passive learning without engagement. 29. What is the FIM efficiency metric used to measure? A. How quickly the assessment is completed. The rate of functional improvement, FIM gain divided by length of stay. C. Cost effectiveness of rehabilitation. Staff productivity. 30. In the context of regulatory compliance, what must be documented along with FIM scores? A. Only the numerical scores. B. The date of assessment, rater identification, and the basis for scoring decisions. C. Patient preferences only. D. Family opinions exclusively. 31. Which FIM item assesses a patient's ability to make reasonable, safe, and timely decisions regarding daily situations? Memory. B. Problem solving. C. Social interaction. D. Comprehension. 32. What is the primary difference between FIM scoring at admission versus discharge? A. Different items are assessed. B. Admission establishes baseline function. Discharge measures outcomes and functional gains. C. Discharge scores are always higher. D. Admission scores don't matter for outcomes. 33. When teaching FIM administration to a multidisciplinary team, which strategy promotes inter-rater reliability? A. Having each discipline score independently without discussion. B. Conducting joint scoring sessions with discussion and consensus building. C. Allowing each person to develop their own interpretation. D. Avoiding any collaborative learning. 34. What does the FIM item expression assess? A. Emotional expression. B. The patient's ability to clearly communicate their needs and ideas through verbal or nonverbal means. C. Artistic ability. D. Personality traits.